Moving a patient to the head of the bed. First step, make sure to carry out initial procedure actions. This includes essentially hand washing. Then when you're done with that, ask for the help of a co-worker. Once the co-worker agrees to help, you can then proceed to locking the wheels of the bed, so avoid moving of the bed so that there will be no mistakes. And also you then move to raising the height of the bed so that you're working in a comfortable position. And also once you're done with that, you lower the rails of the bed. After lowering the rails of the bed, you make sure that the patient is in a comfortable position when all this is done. And also the next step is to move the pillow towards the edge at the top of the bed. The next step, you are to leave the top bedding and then place the drawing sheet. The drawing sheet is supposed to help to move the patient. Also, the drawing sheet, when you're done, you fold the drawing sheet towards the edge of the patient. After folding the drawing sheet towards the edge of the patient, make sure that you're firmly holding the drawing sheet, and that's for ease so that you're able to move the patient properly. Then make sure that your feet is placed like about 12 inches apart, and then you bend your hips slightly. That's for especially for good body mechanisms, to observe good body mechanisms. Bend your hips slightly while undergoing this procedure. And the next step is to count to 3. On the count of 3, you move the patient, supporting the head and the shoulder of the patient firmly. And also, next step, you replace the pillow of the patient's head, under the patient's head. The next step is to make sure that the bed is properly rearrange the bed properly, and then carry out the end procedure action. That is also washing of your hand, taking off essential materials that were used. Thank you.